Standards for Nurse Anesthesia Practice, presented by Katie Pearson and Alex France. The American Association of Nurse Anesthetists developed the Standards for Nurse Anesthesia Practice to provide a foundation for nurse anesthetists in all practice settings. These standards are intended to promote high-quality patient care. The Standards for Nurse Anesthesia Practice are easily accessible. They can be found on the AANA website. Standard 1, Patient's Rights, discusses respecting the patient's autonomy, dignity, and privacy, along with supporting the patient's needs and safety. This standard is met through forming a rapport with the patient during the pre-operative interview and ensuring the plan is catered to their specific needs. Standard 2, Pre-anesthesia patient assessment and evaluation, discusses performing a pre-anesthesia evaluation of the patient's general health, allergies, medication history, pre-existing conditions, anesthesia history, and any relevant diagnostic tests, as demonstrated by performing a pre-operative interview of the patient before providing anesthesia care. Standard 3, Plan for anesthesia care. This standard discusses formulating a patient-specific plan for anesthesia care. This standard is demonstrated by preparing patient-specific care plans based on the pre-operative assessment. Standard 4, Informed consent, discusses obtaining documentation that the patient has given informed consent for planned anesthesia care. Standard 5, Documentation, discusses communicating anesthesia care data and activities through complete documentation in the patient's healthcare record. This standard is demonstrated through pre, intra, and post-operative charting in Epic. Standard 6, Equipment, discusses completing a daily anesthesia equipment check and verifying function of equipment prior to each anesthetic. This standard is demonstrated by performing an anesthesia machine and equipment check before the first case of the day. Standard 7, Anesthesia Plan Implementation and Management, discusses implementing and modifying the anesthesia plan by continuously assessing the patient's response to the anesthetic and/or surgical intervention. The CRNA provides anesthesia care until the responsibility has been accepted by another anesthesia professional. This standard is demonstrated by continuous assessment of the patient in the perioperative period and adjusting the anesthetic plan to the patient's specific needs throughout this phase until care has been handed off to the next provider. Standard 8, Patient Positioning, discusses collaborating with the surgical team to position, assess, and monitor proper body alignment, maintaining perfusion, and protecting pressure points. This is demonstrated through assisting with positioning of the patient and ensuring proper positioning of patient before the surgery begins. Standard 9, Monitoring Alarms, discusses monitoring, evaluating, and documenting the patient's physiological conditions, ensuring pitch and threshold alarms are turned on and audible. Standard 9 also discusses continuous documentation of blood pressure, heart rate, and respiration at least every 5 minutes, along with the continuous monitoring of oxygenation, ventilation, cardiovascular, thermoregulation, and neuromuscular. Standard 10, Infection Control and Prevention, discusses adhering to infection control policies and procedures to minimize the risk of infection to patients, the CRNA, and other healthcare providers. This standard is demonstrated by ensuring proper PPE is used and prophylactic antibiotics are delivered to the patient. Standard 11, Transfer of Care, discusses evaluating the patient's status and deciding when it is appropriate to transfer the responsibility of care to another qualified healthcare provider and communicating the patient's condition and essential information for continuity of care. This standard is demonstrated by assessing the patient before the next stage of care and ensuring they are safe for transfer after anesthesia care. Once this is established, handoff is given to the healthcare provider who will assume the patient's care. Standard 12, Quality improvement process discusses participating in the ongoing review and evaluation of anesthesia care. This standard is demonstrated by continuous research and implementation of quality improvement projects. Standard 13, Wellness, highlights the importance of the provider being physically and mentally able to perform duties of the role. Standard 14, A Culture of Safety, discusses fostering a collaborative patient care environment through interdisciplinary engagement, open communication, a culture of safety, and supportive leadership. This standard is demonstrated by collaboratively working with the interdisciplinary team to provide the best anesthetic care to the patient in the perioperative phase. When reviewing the standards of care, there are several standards we were unaware of. This includes Standard 3, Plan for Anesthesia Care. This standard stresses that after the patient has had the opportunity to consider anesthesia care options, we should formulate a patient-specific plan. The first part of this standard is often overlooked or neglected. We usually formulate the plan before discussing it with the patient without relaying all anesthetic options to them. Another standard we were unaware of is Standard 6, Equipment. This standard states that we should verify the function of equipment prior to each individual anesthetic. Although we check the anesthesia machine and other equipment, such as the end-tidal CO2 monitor, every morning before the first case of the day, we do not recheck this equipment before every case. The anesthesia technicians turn over the room between each case and change equipment, such as the breathing circuits, suction, etc. However, specific equipment function is not checked between each case by the anesthesia provider. Standard 13, Wellness, seems to be a standard that is not frequently met. Fatigue in anesthesia practice is mostly ignored or is accepted as the norm due to persistent, high-intensity work demands and expectations. Standard 13, Wellness, states that the nurse anesthetist is physically and mentally able to perform duties of their role. There is a supporting document included in Standard 13 titled Patient Safety, Fatigue, Sleep, and Work Scheduled Effects, which encourages the use of wellness programs and resources for employees. In order for the standard of wellness to be better met, UCMC could institute a counselor and/or therapist for anesthesia personnel and encourage use of AANA's fatigue resources, which are listed on the AANA website. The AANA Code of Ethics offers guidance to CRNAs to make ethical decisions in all practice roles: clinical practice, nurse anesthesia-related administrative, educational, or research activities, or a combination of two or more of these areas of practice. The Code of Ethics consists of principles of conduct and professional integrity, which help guide decision-making and behavior. The CRNA's ethical responsibility is primarily to the patient, as well as to the profession, other healthcare providers, self, and society. The CRNA acknowledges, understands, and is sensitive to the vulnerability of the patient undergoing anesthesia and preserves the patient's trust, confidence, and dignity. The CRNA collaborates with members of the health professions and others to improve public health and support activities to reduce the environmental impact of disposable items and waste anesthetic gases. As DNP students, we have the opportunity to address issues in healthcare and provide potential solutions for these problems. Several students in the program are currently tackling this responsibility to society with their DNP project, Proper Hazardous Waste Segregation and Disposal in the Operating Room. They are collaborating with the interdisciplinary team to improve waste of hazardous items in the operating room.
When reviewing the Code of Ethics, one component stood out to us of which we were not aware of. The role modeling and education of others is a vital component of the ethical responsibilities of the profession. This idea insists the nurse anesthetist will foster a safe and trusting environment for successful learning for students, colleagues, and members of the healthcare team. It is important to provide encouraging, motivational learning environments to students in order to provide a safe, effective anesthesia to the patients. This is a key component of the Code of Ethics for CRNAs.